Right, there we go. Alright, hey guys, how you doing? So today, I'm Dr. Luke Frazier. Today we're going to be going over a little bit of client therapy. This guy is in a lot of pain. Really trying to figure out what's wrong with him. I want to either find a diagnosis or want to be able to help him in some sort of way, So we're going to be going over two different forms. I'm going to be looking at two different worldviews, two different point of views, to be able to, either diagnose or heal or just treat this guy, help him out a little bit, alright? The first one we're going to go over, I'm going to try to use, is going to be empiricism. Now listen, empiricism itself, the worldview, was started about in the late 1600s by a man by the name of John Locke. He actually said he believed that all of our knowledge must come from the experience of the physical world, through the sensory perception, to our sights, our sounds, what we hear, so what we see, what we feel, what we could taste. All that knowledge comes from any of our senses. Okay. Now, what I really want to use is look at this man through John Locke's perception of tabula rasa, which is the idea that you start off with a blank slate, and all the knowledge is gained, like I said, from the sensory experiences. So we're going to be using formal, specific, scientific experiments that have happened that other scientists, other doctors have already looked at. Now, we're going to use those findings and those knowledge to try to diagnose this man and give him a clear reading of what his real problem is. He's been suffering from a lot of depression, lots of sleep. It's a possibility he may have some PTSD. He's from the war, so we're gonna take a look at all those possibilities and see what we can do with it. The second worldview I want to look at, which I'm more fond of actually, is the humanism, humanistic point of view. Now, this was mainly based in the late 1950s by a man by the name of Carl Rogers. Carl Rogers, his main idea was about the person-centered theory. Now, with that theory, Rogers attempted to change the world of psychotherapy when he boldly claimed that psychoanalytic, experimental, and behavioral therapists were preventing the clients from ever reaching self-realization and self-growth due to their authoritative analysis. Now that's a big hate on empiricism, but I want to try with this guy today. I want to try both forms today. Now, humanism, what I really want to do with this guy today is look at using his thoughts, maybe a little bit of CBT here, a little bit of cognitive behavior theory, with him Aaron back on the side there. Use his thoughts, his feelings, and his emotions, his behaviors. See how they all connect, how they mesh. So we're gonna go over that in a little bit here when he steps in here. So I just want to give a little heads up to you doctors, to you students out there, so we can see what we're gonna be dealing with today. All right, we'll get started in a little bit when he comes in here. All right, stand tap. Come in. Hey, how you doing, Mr. Tom? Please have a seat right there. Okay. We'll get started in a little bit here. Yeah, sit down. Get comfortable. So, how are we feeling today, Mr. Tom?
Well, I'm still pretty bad. Still pretty depressed. Yeah. It's getting harder to sleep. Eating doesn't matter. I don't like to talk to people now. I just find no joy in it right now. I don't really feel like being here talking to you. It's kind of stressing me out, actually.
Right. All right. A little bit depressed. You said you had some new symptoms. Early on, you said you felt you had some newer symptoms. Can you elaborate a little bit on those symptoms, please?
Yeah. I've been feel this like hopeless sometimes. Like that's like there's no tomorrow, you know. Like what am I supposed to do tomorrow? Where am I supposed to go to like, get to tomorrow and do better things tomorrow, you know? Sometimes I just hear these big noises and I don't want to keep going, you know, mine's I don't.
Yeah. Hey, Mr. Thompson, it's alright. It's alright, I'm here. We're out here. We're talking. It's alright. You know, I'm going to go through a couple questions. I want you to think about them, alright? I want you to think a little bit about them. Don't answer yet. Sort of ponder them. So, you know, like I already said, I want to think about the suicide. If you've done anything, had any thoughts and reactions. You know, let me know if you're taking any medication. Again, different from what maybe a recreational drug or anything like that. Do you try to socialise? You talked a little bit about having trouble with socialising now and your friends. Now, you really try to get out there. How about your family relations and your parents? Are you doing well with your family? Let me think about that one. So why don't we go over those really quickly first? Think about those. Just take a minute, think about them for a little bit.
I have suicide. Yeah. One time I almost tried, but I couldn't. I don't know why. No drugs. I've never done drugs. I used to have friends. I haven't talked to them for a while. It's been a long time. I see my mom every once in a while, once a month or something. I haven't talked to my dad for a long time. Not since right after we got back from deployment. I don't know what he thinks about me right now. I think he's disappointed that I came back. So that's what I can think about sometimes is why is he disappointed in me? What did I do? Why am I the bad kid? He doesn't understand me. I don't think. So, like, what am I wrong?
You have a little bit of hopelessness in each day. Now, I'll looking at sort of build on that now. What I really want to look at right now is your relationship with your father, okay? Have you heard of the man John Locke? Sort of ancient philosopher, no? Okay. Well, he had this idea called tabula rasa. Now, that idea was that we're all born with this blank slate, sort of all of our knowledge is gained from sensory experiences, and I'll quote him really quickly. He says that all of our knowledge is founded, and from that, the experience is ultimately derives itself. So, anything that we experience throughout our life, that's where our knowledge is gained from. That's what he's saying. Now, what I want you to share, if you're willing, okay, share a little bit about maybe some experience, some stories that come to mind, thoughts of your dad, thoughts of anything you did when you were younger, anything he's affected you throughout your life. Think back to your younger days, and maybe even right after you came back from the war. What kind of experiences did you go through? What may have happened along the way? Why don't you tell me about the relationship a little bit more with you and your dad, okay?
My dad. Well, I remember one time when I was 7. We're going to the football game, and I was putting on my pads, and he came over to talk to me about the game. He grabs my helmet and looks at me and says, "Tom, if you don't hit those kids hard today, I'm hitting you with the belt later." And he looked at me and said that, and I didn't know what to do. All his threats really hurt. The one thing I really remember is that the one time he actually did it. It was right after my senior year championship football game. We were behind at the last 2 minutes of the game. Ended up throwing a touchdown pass. I caught it, and I scored. We won the game. I thought he was going to be so happy, so excited. But when I got home, he said we should have never been down. We should never been that close. All my friends thought I was a hero. My dad thought I was a piece of crap. A lot of it stemming from these young parental threats. And we've done multiple studies showing that when you're younger like that, and all you hear is threats all day from the man you're supposed to look up to, the mother you're supposed to look up to and learn from. If it's all you hear, it can change you later in life. And I believe that's where these thoughts of helplessness are coming from, the suicide thought, not able to socialise. You have a good relationship with your mother, yeah. I mean, you only see her once a month, but you talk, yeah. Good. Now, I believe what I want you to try to go out and do is talk a little bit, see with your mother a little bit more, okay? With your father, you're just gonna you will have to talk to him a little bit. You're gonna have to tell him what you just told me, that when you were younger, it really affected to who you are today. And that will strengthen your relationship if you talk, be honest with him. Strengthen your relationship, and not only that, but it'll help release some of the pressure from depression. And we'll meet back in 2 weeks, okay? I want to give this a little bit of time so you can go out there and really try hard for this, okay? Alright? Does that sound good to you? Should be good. I'm gonna talk to my mom first tonight. I thank you all, and we'll be back next week. Have a seat, Mr. Thomas. Welcome back, and glad to have you back today. We start with just how you feeling today. Is there anything new that's popped up, or anything you've made some advances on? I've been talking to my dad almost every day last week and this week, and hung out with my friends the other night, and it was good. And I feel like I can talk to them now. I still get those depressed, moments, and, start to worry, and still, I still hear when I hear loud noises, sometimes I sort of get some anxiety still. I sort of freak out still. And I think that's just stayed the same. Relationship with my dad got better, and I think it helped a little bit in my life. I had some good days, but at this point right now, I feel like I'm back to where I was 2 weeks ago. Just still feeling a little bit of hopelessness, it seems like. The anxiety it looks like it's getting a little stronger. I'm really grateful and proud that you made that step in the right direction with your father. What I want to do today is a little bit different, okay? I'm not going to sit here asking you too many questions. I want you to do more of the thinking, right? What I want to do first is go through, and I want you to sort of think and describe a situation. We're going to do a little activity called imagery-based exposure. Now what we're going to do is I'm going to have you call a moment last week that you maybe was very negative, maybe was very hard for you, painful maybe. And I want you to just describe to me what was happening in that moment. Really describe, visualize, sit there for a second, visualize what was going on. Why don't you think about that for a second, right? Then just try to describe to me. I want you to really work hard and visualize what was going on in the moment, alright? Well, so last week, I was just at work and one of my co-workers working on this project, this big presentation. One of my co-workers just didn't agree with my plan. Was really trying to fight against it, and I started getting a lot of anxiety, and I started to get really angry at him. So I left the room and I left work. We were sitting there working on the project. There was a computer, and I guess, I think about it, he was sort of sweating a lot. I don't know why. I guess maybe he was nervous. Really hot day. I think everyone was sort of annoyed with that. Seemed a little tense in the office that day. It was a Tuesday, and usually there's donuts on Tuesday, but no one brought donuts because we were all pretty busy. Like that didn't help us start. I'm thinking about, like, I don't know why I was yelling, and it wasn't that big of a deal. It sort of caught me off guard in the moment that he wanted to do something else when we were almost done almost done the presentation. So that sort of threw me off guard, and I didn't want to change. I just wanted to do my own, do what I said planned. And now I look back at it, his little change that he wanted to make, I think what actually helped. It's good, very, very good there, Mr. Tom. You see how when we go through it, you feel a little better. You seems like you're happy, you're laughing a little bit there, and you sort of see the situation maybe wasn't as bad as you thought it was at the time. Now, is this a activity that you possibly would like to do a little bit more of? Maybe even on your own time if you can? Yeah, I sort of feel a little better now. I think that's something I'd like to do more. It helps to sort of slow it down and really think about my actions before I do it. Because I don't want to, behave like that really anymore. All right, Mr. Tom, I'm really glad we're getting a little bit of progress here. I'm seeing a lot of involvement, and it looks like you're really willing to try here, which is what we're going for. All right. So I want you to go out there, really use those imagery-based techniques, the exposure that I talked about, that we just used. Really visualize and use your thoughts to move forward, to get away, relieve that stress, a little bit of that stress, all right? So keep that going. I want to meet in about a month, 3 weeks, all right? And we'll see where you're at, and we'll move forward from there. But I really believe that, you are motivated to do this. And I think if you keep trying, then you'll be able to get over this little hump in your life and move forward, all right?
It was really nice talking to you. We'll see you again, alright? Have a good one, Mr. Toms. Alright, hey folks again. I really hope you enjoyed watching the therapy session work out there. Just want to talk a little bit about what we saw, and going through, first of all, with the empiricism point of view, we saw a little bit, we really did get that underlying problem, although he still had thoughts on reoccurring depression. I was reading up on a book about cognitive therapy done by 3 doctors, and they were talking a little bit about the empiricist point of view. It says right here that the according to these prevailing views, if the underlying problem were treated, then the thoughts would get better. That was the idea from the empiricist point of view. Now, we saw that just treating the underlying problem did not help his general thoughts get better. The depression came back, he still didn't feel very good. In a humanist point of view, when we did it with that, when we worked through the humanism, that worked much better with CBT. Right from the Beck Institute, we have a little bit here about cognitive therapy. I want to read it all for you. It says, cognitive therapy is educative, and patients are taught cognitive, behavioral, and emotional regulation skills so they can, in essence, become their own therapist. Now, we saw that actually with Mr. Toms here. He worked through it, saw his problem, felt like he had a little control of it. I nudged him through a little bit, and then he moved and stepped over the little hump mentally, and got to a place where he could feel like he could overcome that stress. Take a little bit of the stress off the shoulders and move toward a non-depression state. Now, I just have another little writing here from a man who writes a blog. His name is James Thomas, and he writes a blog about his dealings with cognitive therapy. Now, he was in a much worse depression than Mr. Toms here, but I'll read it off for you, okay? I feel very much like I'm heading in the right direction, and that is that this is due in no small part to the environment created by doing CBT. So we just have another sort of confessional there, resulting in a much better life due to CBT, due to the point of view of humanism and the help of a humanistic therapy. So I hope you all enjoyed, and I look forward to meeting you all again. Thank you.